Hello and welcome to Life and More Conversations, where we explore the issues shaping our lives through expert insights and meaningful dialogue. Today, we are discussing a crisis that has shaken families, educators, and society at large. That's the rising number of student suicide in India. Behind every statistic is a young life lost, a family left devastated, and some very difficult questions about the pressures children face. Are academic expectations really killing the children? They are becoming unbearable for them. Are we missing the warning signs that they show? What can parents, teachers, society, and the government do to prevent these tragedies? What can we do to tell a child that suicide is not the way out? To help us understand these issues, we are joined by Dr. Sumit Gupta, an eminent psychiatrist who has extensive experience in dealing with mental health challenges across different age groups. Welcome, Dr. Gupta. Thank you for joining us today.
Thank you for having me.
Yeah. So, Dr. Gupta, I'll begin with the first burning question that we are facing today. The CJP protest that started with the NEET paper leak and the suicides that happened after the paper leak happened. So, what's your take on that? Do kids commit suicide due to paper leaks?
Uh, Kids do commit suicide. So if we go to the 2024 data from National Crime Records Bureau, that is the latest data on suicides from India. So student suicides account for something more than 8% of the total suicides in India. So
Okay.
students do commit suicide, and the reason listed in the data set that is available officially, the most
Mm,
common reasons are the family problems and illnesses. So both these reasons together account for 50% of the all suicides.
mm,
Uh, about this pertinent and burning question of the paper leak,
mm,
if we go into the data available from around the world, we
mm,
know that hopelessness is the most common underlying reason or the immediate reason for suicide. So, if a person or a student is feeling hopelessness, that the
mm,
system is hopeless, we are doomed, we can't do anything to
mm,
get into a better state, or what we desire we cannot achieve with any fair means,
mm.
then this can be a precipitating cause for suicide.
Okay.
So paper leak, theoretically, it may be one of the cause of suicide.
Okay. Okay. And it's happening across the country. है ना? It's not that a particular area is reporting these cases. So,
Yes,
and this is happening despite there, like of late, especially after the COVID-19, there has been an increased stress on the mental health. Huh?
yes.
And people are more aware about mental health and they are going to shrinks for their issues. Still, suicides are happening. So, why is it that despite like available resources to mitigate that issue, why are suicides still happening?
Uh, there is still a great degree of stigma associated with mental health help seeking. Not only in India, but even in most advanced countries of the world, still there is a great amount of stigma that still happens, and people uh, genuinely, because of the stigma or for economic reasons, or there are even areas within India where mental health uh, facilities are not even available in many districts in India. So there are many reasons, social and logistic reasons, for which there is still a large degree of mental health care gap in India. Not
Hmm.
only in India, but across the world, there is a great gap in the actual needs and the services available for that.
Okay. So, what about students? Like, what is the status of students? Because I believe every school has a counselor associated with it. That's as per the government guidelines. And what is it that drives students? Like, is it the academic pressure which is unbearable, uh, or the social pressure, the peer pressure? What is it? The maybe inability to conform to the peer group.
Hmm. So here I will like to
Mm,
delve into the data that is available from abroad. Here in India, whatever data we have is from the police records, and there the data is colored by whatever the report the police gets during the investigation of suicide. So from abroad, whatever data we have, around 90% of the individuals who commit suicide, they had some or the other mental health disorder or substance use disorder. So mental health disorders that remain undiagnosed or they are inadequately treated, they
mm,
are the major chunk of uh, what comes as suicide later.
okay. So, like, I'm very confused. Like, what can the family do? What can the teachers do? What can the society do? Matlab, are there any, say, warning signs that a suicidal person
Yes,
shows?
yes, yes. There are warning signs and symptoms of each and other mental health disorder. So,
Mm,
the most common symptoms with which parents or the teachers or school counselors
mm,
they can get to know there is something happening with this child is like a child is withdrawn socially. He has stopped meeting other people, peers. He has stopped going for play. He is not interested in studies. There is a great change in his usual behavior, changes in the sleep pattern, or changes in the food intake, irritability, or there are certain direct signs like previous suicidal attempt or self-harm behavior. So these are great warning signs and symptoms that parents as well as teachers need to be careful about. And if manifested, mental health help seeking should be the first thing to happen.
mm. And what about academic pressure? Like, there are many parents who are, because I have read in news about children who commit suicide. They often write a letter to their parent, "I failed, I failed you, I couldn't clear this," or whatever. Usually that happens. So that means the parents are putting a lot of pressure on kids for academic excellence.
Yes, not only parents, teachers, our
Mm,
academic system has been designed in such a manner that it facilitates competition or unhealthy competition, say. Whatever we all read newspapers,
mm,
and it is not uncommon to see photographs of children who have ranked first, second, third in
yeah.
NEET, JEE, and even schools they publicize their
Mm,
toppers. So the whole system has been designed in such a manner that
mm,
academic excellence is something that is seen as a virtue, and failure is something that is
mm.
seen as that this child
Liberation.
cannot do anything in
Mm,
future.
mm.
So our whole system is geared in that direction only.
So what to do in such a situation? What can parents do? Matlab, what is the way out? It's a very
First thing
vicious
is,
kind of.
first thing is awareness about the mental health situations, mental health
Mm,
illnesses. So mental
mm,
illnesses, they are genuine illnesses, they can be treated. Most
mm,
commonly, what happens is ki if a child voices that he is not feeling well, he is not feeling
mm,
okay, the
mm,
usual response is dismissal of the complaint. You are just a child. You do not know what the stress
mm,
is. Hmm.
mm,
We as parents, we are doing this, that we have to earn what we do. You do not know. So
mm.
dismissal is not the right way. If child
Okay.
is voicing something,
Mm,
it is important for the child. We should not dismiss that straightforward. Most
mm,
commonly, this is the reason that child feels that no one is able to understand me, what I am
mm,
going through. And
mm,
this hopelessness, solitude, these are the most common underlying feelings that drive suicide. So a child
mm,
should not feel that no one is able to understand my feelings.
mm.
So most common things that should be avoided is parents should just be supportive, listen to the child first rather than
Okay.
straightly dismissing what the
Mm,
child is feeling. If child
mm,
says, I am feeling low, I am not feeling okay,
mm.
just give him a space. Tell the child
Okay.
it is okay to not feel good at times. It is okay
Mm,
to cry, vent out feelings. We
mm,
understand we are with you despite
mm,
whatever is happening with you. We
mm.
will be there and hear the child out rather than dismissing the complaints.
Okay.
Few other things that may be avoided, uh, like be strong. This is something that is a person who is feeling hopeless. For that
Mm.
person, it is a straight dismissal of his feelings. That
Okay.
yes. So if you say that be strong when a
Mm-hmm.
child is crying, expressing himself before you, you are saying that you are weak if you are expressing this to me. So this response should not be should not happen with the child. We should hear the child. We should validate the emotions that okay, we acknowledge you are feeling low, you are not feeling okay. We are with you. We will work on this.
Okay.
So this should be the appropriate response to the child.
Okay. That means because normally we do say be strong. That means being overly positive is also not a good thing for mental health.
We have to be uh, aware of what the child is feeling at that point of time.
Mm,
Child wants to be heard.
mm,
Whatever emotions the child has, he wants to
mm,
communicate, transmit that emotion to you. If your response is like the child feels that my emotional experience is being dismissed, it is being
mm,
said that you are weak or I am being judged in some negative manner. So
mm.
that should not be the actual feeling after expressing himself.
That will close him up. We'll not talk
Yes.
about it again, no?
Yes. So if the response is ki you are weak, if directly
Mm,
or indirectly,
mm,
if you are saying that be strong, that means you are
mm,
weak if you are expressing
mm.
yourself.
Yeah,
Hmm.
yeah,
So do
yeah.
not cry, be strong, or just telling that we had faced so many stresses, we have never wept like this. So
Okay,
these things should be avoided.
okay,
So if
okay.
you say these things, the child
Mm,
feels isolated. Even if
mm,
I express myself, no one is going to listen to me. They will
mm,
judge me as weak or
mm,
incompetent to handle my emotions. So
mm,
better to deal it myself in my way. And that way may be suicide actually.
mm. But there are many children who won't come and talk to their parents or the teachers or with the friends even, whatever they are going through inside. And they prefer
Hmm.
to like keep it to themselves. So how to help those children who are like very introverted, not interested in talking about themselves? How to do? What to do for them?
Maybe teachers and parents need to be proactive for those
Hmm,
children. So
hmm,
if they witness there is something wrong, a child who was lively earlier
mm,
has now
mm,
become withdrawn. So there is
mm,
definitely something wrong emotionally with the child if child is
mm,
not behaving in the way he or she used to.
mm,
So their parents or teachers need to reach out to the child. Okay, we
mm,
see that there you are appearing a bit not okay emotionally,
mm,
and it is
mm,
okay that
mm,
if you are feeling low, we are with
mm,
you, just express yourself. And
mm,
even if you do not express yourself, we are with you. So the
mm,
child should not feel that he is or she is isolated.
mm.
Isolation, hopelessness, these are the most important driving factors
Yes.
for suicide.
Mm. And what about social media these days? Because children, even youngsters, like older people, they constantly uh, seek validation from social media. And there's a lot of competition there, and
Hmm.
posting pictures and getting likes and views. All that is there. What to do in such a situation?
Maybe limiting social media exposure, especially for young children, like some of the countries,
Mm,
Australia or France, they have done for their children.
mm,
Government should look into that direction.
mm,
And also parents, teachers, they need to emphasize and remind the
mm,
little minds that,
mm,
okay, so we do not put a crying picture on social media. We just
mm,
put up whatever is the best with us.
mm,
So if we
mm,
see people attaining great heights or people enjoying their lives, visiting too many places, doing great
mm,
things, it is whatever is best available with them they are displaying.
mm,
There is a darker side to it as well, but no one
mm,
puts up the darker side. So that needs to be reminded maybe multiple times so that it
mm,
does not like there is a bias in the mind that whatever
mm,
is happening, a great things
mm,
are happening with each and every person, and it is my life which is hell.
mm.
So that needs
Yeah.
to be reminded that each and every person just puts up whatever is best with him or her. Most
Uh,
of the people do not voice their grief or their negative emotions over social
mm,
media.
mm. So that parents have a double duty towards at that point.
Yes.
Mm, mm. And should mental health screening, counseling, suicide prevention programs be made mandatory in educational institutions like schools and colleges?
Yes, they should be. And
Mm,
uh, as far as I know, there are guidelines in place.
mm.
There were
Okay.
Supreme Court guidelines after quota suicides that are in
Mm-hmm.
place, and there have been some action
Mm.
in that regard. But the action should not be a compulsion from above.
Ah, yeah.
Whatever like teachers and parents they need to do it
Mm,
voluntarily. They should
mm,
understand that there are mental illnesses, mental health and emotional issues that do
mm,
occur, and even
mm,
children face emotional issues.
mm,
Because when we deal with young people, most of
mm,
the parents, their reaction is dismissive, like
mm.
how this child is feeling depressed. Uh, this is not the age to be depressed. So there is
Okay.
no age that is immune to mental illnesses or emotional issues.
Mm,
So the reaction should not be straightforward dismissal. That is most
mm,
important thing, because dismissal is something that becomes
mm.
a triggering factor for the child.
So, Dr. Gupta, in your work over the years, uh, I'm sure you must have counseled parents and kids, uh, children who come to who either their parents bring or children coming on their own. What kind of mental health issues do you are very common in children, and like are there younger children like pre-adolescents also facing mental health issues? What kind of issues are they? And second, what kind of issues are older children facing, like 11th, 12th, or college students are facing?
Okay, so if we go to the pre-adolescence stage,
Mm, mm,
there the most common issues are like learning disabilities, attention deficit hyperkinetic disorder, and anxiety disorders. So
okay.
these issues are the most common complaints with
Mm,
children younger than 11 or 12 years of age. And if
mm,
we go with the children more than 11 or 12 years of age,
mm.
their attention deficit hyperkinetic disorder, anxiety disorders, depression, these are the most common issues that these children face.
So, have the numbers, what has been the numbers over the years? Like, say, if we compare it to 10 years back to today, have the numbers increased, decreased, or remain the same, more or less?
Uh, like the help seeking has increased. So the
Okay,
actual number of children who are coming up to the clinic may be more. But
okay,
actually, the prevalence of these disorders that has
hmm,
been more or less static across the time period, across
okay,
different geographies. So the
okay,
prevalence rates have been more or less similar, except for
okay.
few things like autistic spectrum disorder or attention
Oh,
deficit hyperkinetic disorder. There,
hmm,
the actual prevalence has seen an increase over time. But for
okay,
anxiety disorders or depression, the rates have been more or less similar if we go into the systematic data that has been collected over time.
okay. But what's the reason for autism and ADHD registering an increase over the years?
Exact reasons are not completely understood very well.
Hmm, hmm,
So we must admit that all the putative hypotheses they do not add up to the numbers. But yes,
hmm,
some of the reasons may be like attention deficit can be because of sleep deprivation. So sleep
okay,
is something that in this current generation exposed to social media screen, they miss their
sleep
sleep
hours.
time. Yes, and so that results in inattention. So that can be one of the reason.
Okay,
And for autistic spectrum disorder, there has been some change in the diagnostic criteria. It has become
okay,
more inclusive, and
okay,
also one of the reason is the increasing parental age at the time of birth.
okay.
So the genetic material in the sperm and ova that deteriorates with age. So higher the
Hmm,
age of parents at birth, the
hmm,
likelihood of the child having autistic spectrum disorder increases. So
okay,
late births is one of the reason.
okay. And is there any difference in the among the genders? Like, are the males more prone to the mental health issues, or females more prone to? Or is there a divide in the social strata, a particular social strata which is more susceptible to mental health issues? Is there a thing?
Or females, they
Hmm,
do encounter more of depression and anxiety disorders. And if
okay,
we go with the autistic spectrum disorder, there is a male preponderance.
okay.
So
And
there is, yeah, is.
social strata, does it
Uh,
make a difference?
Social strata does not make a difference in the actual prevalence, but the
Hmm,
detection rates may differ.
hmm,
People from poorer socioeconomic strata where
hmm.
there's not much of an education or awareness, they miss many of the mental health conditions. So the actual detection may be different, but the prevalence may be same.
So now I'll come back to the ongoing protest. I'm sure you've seen the visuals that keep coming through the TV, through the social
Yes.
media. There are some of the students who are students, I don't know whether they are students, but youngsters more into violence, like no damaging property, or there have been instances of youngsters molesting women, or there are youngsters who are like very angry in their outbursts. So do you suspect a mental health issue there, or it's a normal thing for a for an angry person to do?
Oh, even in anger, one is supposed to express some restraint. So, physical aggression cannot be
Hmm,
justified in any manner and should not
hmm,
be. There is usually some or the other issue that is evident in such an expression. So,
hmm,
there may be underlying mental health disorders. Sometimes, what happens, psychotic disorders, even mania. If I recall the Anna movement,
hmm,
I was practicing at Ibhas at that time. So we
hmm,
daily had one or the other patient with the manic episode who would come up dressed in the typical that topi, like
hmm,
I am Anna Hazare and I
hmm,
want to change this world. So some children or individuals with mental illnesses, they may be carried away with the prevalent mood in the society, and
hmm,
they may manifest some of the unusual things. So
hmm,
one reason may be this, and
hmm.
but much more common reason may be antisocial personality traits. We do
Okay.
know that some individuals in every society, they exhibit antisocial personality traits. And
Hmm,
so in any large gathering, say there are 1 lakh people, so if only hundreds of them do carry some these kind of traits,
hmm.
they can exhibit such kind of reckless behavior.
Okay. Are you have you got any patient in these many days since the protest started?
No,
Okay. Okay. Okay.
not directly connected to this.
Okay. So, if you had an opportunity to change just one thing about, say, parenting, one thing about schooling, and one thing about society that could help young lives, what would that be? Like one thing you would tell parents to do, the schools to do, and the society to do, so that the suicides are maybe not stopped, but at least brought down.
Hmm. So the most important thing would be at the societal level, accept each and every individual
Mm,
despite any kind of limitation.
mm,
So if I know that I will be accepted despite whatever limitation I have, I may be
mm,
scoring less, I may be less able in certain aspects. So I am sure that I will be accepted and I am
mm,
not isolated. So at the societal level, acceptability, accepting each and every person
mm,
despite whatever he or she thinks or behaves like. So
mm,
this is the foremost culture that needs to evolve. At the school level, teachers should not put just academic pressure on the children. It is
mm,
their duty to teach.
mm,
Whatever the child learns, it is okay.
mm,
So, how the child performs should not be the only benchmark. Yes, teachers have the duty to assign marks on the basis
mm,
of performance,
mm,
but any child should not be ridiculed on the basis that you did not get good marks. It is your duty. Be honest in checking. Even if a child is failing, is getting 0 marks, do assign marks, but the child should not be humiliated for that.
mm,
Hmm. And at the parental level, parents should be receptive. Just listen to the child. Whatever he or she wants to say, listen to that. Do not be in a hurry. Do not dismiss the feelings of the child. Just hear the child out. This is the best policy.
And what would you say to the students who are feeling overwhelmed or any feeling low or not capable enough as their other peer group is? What would you tell students, youngsters?
Hmm. So one thing is it is okay to cry. It is
Hmm,
okay to feel low at times. It is
hmm,
okay to feel overwhelmed, and it is okay to seek help from others.
hmm.
Hmm. So this is the most important message I would like to share.
Okay. Thank you so much, Dr. Gupta, for talking to me and sharing your valuable insights and helping us all understand this deeply sensitive issue with such clarity. One thing which I got is the word dismissal should be not there in the dictionary of parents. They should never dismiss any feeling of a child a child is expressing to them, right?
Yes. Yes.
So, and if there is one takeaway from today's conversation, it is like nothing in life is worth giving away the life. No career setback, no failure is taking your life, right?
Yes. You can always do something in life without any degree.
Hmm. And mental health deserves the same attention and urgency as physical health. So, I request to all the parents and all the teachers and everyone out there that give equal importance to mental health as you give to your physical health. Don't dismiss, don't dismiss the mental health issues as not happening, or don't be ashamed of anything that your child is telling you. If a child is having a mental health issue, accept that and seek help. If you're struggling emotionally, if somebody around you is struggling emotionally, please don't suffer in silence. Reach out. And thank you everyone for listening to this Life and More conversation. If you found this episode meaningful, please share it with your family, friends, and educators. And don't forget to subscribe so you never miss an episode. Until next time, take care of yourself and of one another. Thank you.
Thank you so much for having me and sharing
Yeah,
this important message.
yeah. Thank you. It was a pleasure having you, sir. Thank you.